Good afternoon, everyone. On behalf of the University of North Carolina at Chapel Hill, I would like to welcome you to the 2021 Commencement celebration for the UNC Eshelman School of Pharmacy. I am Angela Kashuba, Dean of the UNC Eshelman School of Pharmacy, the #1 ranked pharmacy school in the nation. It is truly an honor to share this special day with you, and I would like to take this opportunity to congratulate each graduate from the Master of Science, Doctor of Philosophy, and Doctor of Pharmacy programs in our school. We are so proud of you. This ceremony is a testament to your hard work, dedication, scholarship, and ability, all of which are traits that will serve you well as you begin your careers. You have flourished despite all the hurdles the pandemic presented to you. You are truly exceptional. I would also like to recognize your family and friends, who I know are logged in now, who have contributed so much to your collective successes, and who are just beaming with pride in your accomplishments, just like our faculty and staff are. You represent the future of pharmacy and pharmaceutical sciences. Regardless of your career intentions, the future is bright for all of you, and by extension, for our profession and science in general. And I know you are prepared to represent the school well in everything that you do. The world needs you more than ever now. At this time, I would like to begin today's ceremony by introducing our keynote speaker, President James E. K. Hildreth. President Hildreth was born in Camden, Arkansas, and graduated from Harvard University, magna cum laude in chemistry, and was the first African-American Rhodes Scholar from Arkansas. He later graduated with a PhD in immunology from Oxford University in England. He returned to the United States to attend medical school at Johns Hopkins University School of Medicine, and later joined the Hopkins faculty. In 2002, President Hildreth became the first African American in the 125-year history of Johns Hopkins School of Medicine to earn a full professorship with tenure in the basic sciences. He later became director of the NIH-funded Center for AIDS Health Disparities Research at Meharry Medical College. In 2011, President Hildreth became Dean of the College of Biological Sciences at the University of California, Davis. President Hildreth returned to Meharry Medical College in 2015 to serve as the 12th president and chief executive officer of the nation's largest private, independent, historically Black academic health sciences center. In his well-recognized and groundbreaking career as an immunologist and academic leader, he has published approximately 100 scientific articles and is the inventor on 11 patents based on his research, which has contributed to efforts to eliminate HIV/AIDS worldwide. We are so honored to have a partnership with Meharry in research and graduate education, and are so fortunate to have him speak to us today. Please join me in welcoming President Hildreth.
To Dean Kashuba, faculty, trustees, families, and graduates, I'm honored to have been asked to speak on this very special day. First, I would like to congratulate the graduates and their families on reaching this milestone. This day marks the culmination of disciplined effort and commitment over many years. It would not be fitting to mark this occasion without acknowledging what we've all lived through over the last 15 months. In December 2019, the human race encountered a pathogen it had never seen before. The coronavirus, SARS-CoV-2, the causative agent of COVID-19 disease. Having never been exposed to this virus, humans were immunologically naive to it, and SARS-CoV-2 rapidly raised to the human population, causing a major pandemic. As of May 1st, there have been more than 151 million known cases of COVID-19 globally, 33 million of which occurred here in the United States, and 3.2 million deaths overall, with more than 576,000 of those deaths here in our country. For the United States, the COVID-19 pandemic now is on the same scale and scope as the 1918 influenza pandemic. In 1918, there were no ventilators, viral therapeutics, infectious disease specialists, social media, or other means of rapid mass communication. We have all of those things now, and yet in many ways, SARS-CoV-2 has had the upper hand for much of the fight against it. The COVID-19 pandemic exposed the dangers of leadership that is not led by science during a national public health crisis. It illuminated the consequences of allowing politics to handicap the extraordinary agencies in the United States created to deal with such crises, the CDC and the FDA. COVID-19 also shone a bright light for all to see the chasm in health status among population groups here in the United States. The health disparities highlighted by COVID-19 are long-standing, and minority communities have had a much higher rate of chronic diseases for decades. Because they have a much higher burden of chronic diseases such as high blood pressure, diabetes, asthma, cardiovascular disease, and obesity, African American, Latinx, and indigenous communities have been ravaged by COVID-19. Indeed, in some cities, such as Detroit, at one point, the death rate from COVID-19 was almost 10 times higher for African Americans than for Caucasians. The pandemic also revealed how unprepared the country was to deal with a national public health crisis, despite spending an astounding $17.5 trillion per year on healthcare. Imagine a country spending trillions of dollars on healthcare, having to scramble for masks and swabs. The pandemic disrupted every aspect of life and decimated the global economy. It required drastic and immediate changes in how education and training is carried out at all levels, including the programs such as the ones you're graduating from today. We were kicked out of research labs for extended periods, and in-person teaching experiences shifted to virtual web-based methodologies. This created a deep sense of isolation and separation for most students. And for those in programs in which being in the lab was necessary to generate and collect data, there were high levels of anxiety and stress. It is fair to say that very few, if any of us, have experienced a year quite like 2020 in our lifetimes. Despite all the challenges and shortcomings revealed by COVID-19 in 2020, the year will also be remembered as one in which science showed its power in dramatic fashion. The one and only way out of the pandemic without an unacceptable, unthinkable number of people dying was a vaccine, something that only science could deliver. And deliver it did. As of May 1st, 1.2 billion vaccine shots have been administered around the globe. Here in the United States, more than 242 million vaccinations have occurred, and more than 100 million adults are now fully vaccinated against COVID-19. Not one, not two, but multiple safe and effective SARS-CoV-2 vaccines were produced in a year or less. Vaccine development up to this point has taken as many as 100 years, or a minimum of 4 years. Many are distrustful of COVID-19 vaccines because they were developed so rapidly. So how did they do this? How were these vaccines developed in record time? The technology brought to bear in response to COVID-19 is truly remarkable. For example, the genome sequence of SARS-CoV-2 was published in January of 2020. In less than a month, multiple companies had already identified a lead vaccine candidate. This process alone normally takes a year or more. Vaccine development is typically an iterative process done in sequential steps or phases, lasting months to a year or longer. Given the urgency, assumptions had to be made and resources proffered such that the phases of COVID-19 vaccine development could be performed in parallel, not in sequence. This alone allowed the vaccine development time frame for this virus to be compressed considerably. And another consideration, HIV was discovered in the early 80s, and scientists have been trying to develop a vaccine against the virus for more than 30 years. Unfortunately, the effort has not produced a vaccine, but what it has produced is a remarkable global infrastructure for vaccine development consisting of scientists, facilities, protocols, and technologies. Early last year, this infrastructure paused the work on HIV and turned its focus to SARS-CoV-2 to great effect. The combination of extraordinary advanced technology, parallel processes, and a remarkable global vaccine development infrastructure facilitated development of COVID-19 vaccines in record time. Another major contributing factor was the unprecedented collaboration between scientists around the globe, and also something we've never seen before, collaborations between big pharma companies that are usually strict competitors. Clearly, from my perspective as a scientist who spent 40 years in research focused on a pandemic pathogen, HIV, developing safe and effective SARS-CoV-2 vaccines in record time has to be viewed as one of the greatest achievements for science of this century so far. And I hope for you, the graduates, despite all the challenges brought on by COVID-19, that the response from the universe of scientists is both inspiring and affirming. Since science, especially pharmaceutical sciences, was key to literally saving humanity. Immunologists, virologists, structural biologists, research physicians, biostatisticians, bioethicists, and engineers all contributed to success. Pharmaceutical scientists were clearly pivotal to success. The vaccines currently in use would not have been possible without advances made in formulations, pharmacokinetic modeling, high-throughput screening, animal models, and other areas. The COVID-19 pandemic is certainly not going to be the last global or national health crisis for which science is the required answer. The scientists who discovered messenger RNA back in 1961 could scarcely have known that their discovery would be key to fighting a pandemic virus 60 years later. This fact illustrates the extreme importance of sustaining basic scientific research, as we never know which discovery will be key to solving a future problem. So to my young colleagues, as you now embark on the next phase of your careers, I hope you will do so with renewed inspiration and motivation, having seen firsthand how important and relevant your work can and will be to solving problems facing humanity. This is true not just in the case of pandemic viruses, but for long-standing challenges represented by other infectious agents, such as HIV, and diseases such as cancer and heart disease. Always follow your passions, as this will result not just in a good job or excellent career, but in a great life. Commit to being lifelong learners as scientific knowledge and technologies are continually evolving. One of the great lessons of 2020 is the extreme power of collaboration, and I urge you to approach your future work in that spirit. And if you do, expect to achieve great things. Congratulations, graduates. I wish you much success and satisfaction in your lives and careers. Thank you.
Hello, I'm Kim Brower, Associate Dean for Research and Graduate Education in the UNC Eshelman School of Pharmacy. What a great day to be a Tar Heel as we celebrate your graduation. The UNC Eshelman School of Pharmacy awards Master's and Doctor of Philosophy degrees in the pharmaceutical sciences. These advanced degrees mark the culmination of years of hard work, dedication, and scholarly effort. To our graduate students, this special occasion is a celebration of the completion of another chapter in your journey and represents one of the most important beginnings that you will ever experience. One full of promise and possibility as you transition from students to independent researchers, scholars, and leaders. As a graduate student at Carolina in the top-ranked School of Pharmacy, you have had the privilege and opportunity to discover, teach, engage, and achieve at the highest level of academic success. Each graduate student we recognize today receiving their master's or PhD degree has advanced important new knowledge that benefits the citizens of North Carolina, our country, and the world. And for that, we are very proud of you. Along the way, you have gained key perspectives about your own talents, leadership, and abilities to solve complex problems in the pharmaceutical sciences, in pharmacy administration, and beyond. You have persevered in spite of all the challenges and hardships that COVID has presented to all of us. We are confident that you will make transformative contributions to healthcare in the coming years as well-trained, well-prepared scholars who can endure just about anything. We have believed in you, and now we are counting on each of you to make a difference in our world. Whether your contributions are in drug discovery or in the development, delivery, or optimal use of new medications, or in improving the quality of pharmacy services in hospitals or health systems, we encourage you to share your knowledge, to take on challenges, and to be innovators. More than ever, our world needs your talent and your commitment, your persistence, creativity, and most importantly, your leadership. On behalf of the Graduate Program Administration, your major advisors, all the faculty who have mentored you, and the family and friends who have encouraged you, congratulations to the class of 2021. Go out there and do great things, and remember to keep in touch with us. And now we will hear from Allison Mercer-Smith as she offers her reflections on behalf of the graduate students' experience over the past few years at the UNC Eshelman School of Pharmacy.
My name is Allison Mercer-Smith, and I am an MD-PhD student. I am here today because I have a personal vendetta against cancer. When I was 15, I was diagnosed with ovarian cancer. I was really lucky because I'm healthy today. But through this experience, I met so many other people who were not so lucky. And I decided that I wanted to spend my life fighting cancer. The world of cancer therapeutics is rapidly changing, and there is so much hope for the future. But there's still so much work to be done. If you have enough chemo, enough radiation, enough surgery, enough small molecule inhibitors and immunotherapies, if you throw the whole kitchen sink at the cancer, you can do a lot of damage to the cancer. But what about the patient? One of the most beautiful and fascinating parts of pharmaceutical science, and about molecular therapeutics in particular, isn't just about killing the cancer. It's how do we protect the rest of the patient? How do we attack the tumor while keeping the patient safe? Of course, this doesn't just apply to cancer. How do we target the infection site, but not the entire patient? How do we treat the inflammation without impacting the whole immune system? How do we convey important information about invaders to the immune system without causing dangerous inflammation? These have been particularly important questions in the last year. I'm sure none of us thought our final year in grad school would look like this, wearing masks and face shields, coming into lab when it's still dark for capacity restrictions, having our defenses and graduation parties over Zoom. But 2020 and 2021 have shown us how impactful scientific research can be on the lives of everyone around us. How even non-scientists can suddenly start reading the New England Journal of Medicine and follow the progress of clinical trials. Because this is what many patients and their families have always done following a devastating diagnosis. They turn to scientists and those leading at the cutting edge of the practice of pharmacy. They are turning to us. They are trusting us. So let's show them what we can do.
Good afternoon, and thank you for joining us today to celebrate the successes of our pharmacy and graduate students. My name is Michael Jarsper, and I am the Assistant Dean for Graduate Education and the Director of Graduate Studies at the UNC Eshelman School of Pharmacy. It is my pleasure to announce this year's Pharmaceutical Sciences graduating PhD students. These students have dedicated 4 to 5 years investigating important topics in drug discovery, drug delivery, drug action and metabolism, and pharmaceutical outcomes. And we are very proud of this year's group of newly minted PhD scientists.
Hunter Nicole Bomba, Advisor Sean Hingston. Drew Sesta, Advisor Jeffrey Abe. Matthew Stephen Dixon. Advisor, Jennifer Elston Lafata. Ryan Hickson. Advisor, Gong Thong. Maurice Horton. Advisor, Jan Liu. Wulin Zhang. Advisor, Sean Hinchton. Nicholas Kloos. Advisor, Jeffrey Abe. Allison Rose Mercer-Smith. Advisor, Sean Hinchton. Sarah Musetti. Advisor, Leaf Wang. Joel Nguyen. Advisor, Alan Kinlaw. Erin Marie Burgunder Schultz. Advisor, Angela Kashuba. Zoe Tang. Advisor, Carter Chow. Mengan Zhang. Advisor, K.H. Lee.
Good afternoon, and thank you for joining us today to celebrate the successes of our pharmacy and graduate students. My name is Stephen Eckel, and I am the director of the MS program in the Division of the Practice Advancement and Clinical Education at the UNC Eshelman School of Pharmacy. It is my pleasure to announce this year Pharmaceutical Sciences graduating MS students. These students have spent 2 years learning about leadership topics in health system pharmacy administration, and we are very proud of this year's group of newly minted master's graduates.
Blake Barlow, Advisor Chris Fortier. Joseph Breedek, Advisor Catherine Muir. William Kyle Cornell, Advisor Meredith Hollinger. Jimmy Godwin, Advisor Stephen Eckel. Kenneth Guzman Rodriguez, Advisor Lindsay James. Pavan Kular, Advisor Stephen Eckel. Judith Levint, Advisor Mary Haston Vest. Connor Myers, Advisor Daniel Schenkett and Scott Savage. Autumn Peterson, Advisor Mary Haston Vest. Robert Stephen Richardson, Advisor Joseph Bonkowski. Charles Summerlin, Advisor Kayla Waldron. Jose Tamayo, Advisor Stephen Eckel. Joshua James Tesson, Advisor Kevin Hansen. Amy Thompson, Advisor Kevin Hansen.
Good afternoon, class of 2021 and guests. I'm Wendy Cox, Vice Dean of Professional Education at the UNC Eshelman School of Pharmacy. As we transition to the celebration and hooding of the PharmD candidates, I would like to offer my sincere congratulations to this very special class. Our Doctor of Pharmacy graduates are clinically trained to provide pharmaceutical care and are well positioned to address the most pressing healthcare needs in a variety of patient-centered roles. As they so aptly demonstrated this year, this class of remarkable individuals are leaders and innovators who recognize the healthcare needs of patients and are well prepared to meet the challenges of the future. They have and will continue to impact their local, national, and international communities, whether that is providing direct care to patients in healthcare systems and community pharmacies, or impacting patient care in managed care organizations or the pharmaceutical industry, for example, with all paths ultimately improving the health of others. While this year has been difficult, the PharmD class handled the COVID pandemic with grace, determination, and action, mobilizing to provide testing and vaccinations to communities across North Carolina, in addition to their many other responsibilities in their practice sites. On behalf of the school and all of the faculty, congratulations on the accomplishments of this milestone. We are very proud of each of you and recognize that you have impacted the school and will leave us in a better place than when you entered. We are excited to see what the future holds for each of you. I would now like to introduce Jeffrey Sills, President of the Doctor of Pharmacy Class of 2021. Jeffrey will offer some reflections on the professional students' experiences over the past 4 years at the UNC Eshelman School of Pharmacy.
Hello friends, faculty, and families. My name is Jeffrey Seals, and I have had the honor of serving as the Class of 2021 President for the past few years. I've been extremely excited about preparing this address, realizing that this will be one of the last times I'll be able to virtually stand before you before most of us transition into our postgraduate lives as the new class of pharmacists from the UNC Eshelman School of Pharmacy. There have been thousands of graduations over the years, each being special and unique in their own ways. However, most of them have not been held in the middle of a pandemic. I am so proud to be part of a graduating class that stood in the face of a global pandemic and rose to the occasion to address the needs of their community. From completing 9 advanced pharmacy practice experiences during a pandemic, to volunteering your time and energy to helping to vaccinate communities all across the state of North Carolina, to tackling a year of virtual info sessions, networking events, and interviews, the class of 2021, in my biased opinion, is the most resilient and prepared for anything that could come along in our long careers ahead. What a time we have had over the past 4 years in Chapel Hill and Asheville. I remember my first time arriving on UNC's campus for orientation. It was a hot and humid day in the beginning of August, but there was something special in the Carolina air. Meeting my new classmates and friends in Beard Hall, finding the seat I would sit in car 1001, and absorbing all that I could about what it would be like to be a PharmD candidate from our dean and faculty, it was an exciting start to this chapter of our lives. After orientation, and most days after bridging course, I found myself walking from the pharmacy school to Franklin Street with new friends, most likely going to the Old Well, Topo, or He's Not Here. These moments early on in my time at ESOP showed me that I had made the right choice in coming to Carolina. As we moved throughout the curriculum, we always found ways to make light of stressful courses and cases with the help of our classmates and amazing instructors. From simple words of encouragement to a due date being adjusted during a particularly stressful week, of which there were many, we made it through one semester to the next. It goes without saying that one thing that makes our program so amazing is our faculty and staff at the school. They all have served as mentors and preceptors to each of us and have truly molded us into the pharmacists of tomorrow. And for that, we are all so grateful. Next, I want to send a very special thank you to all of the families who have supported each of us along this journey. I know personally I wouldn't have made it through without the love and support and many phone calls of my mom, my dad, my sisters, and my grandma. Thank you for always having my back and encouraging me to be the best version of me I could ever be. I'm here because of you. Finally, I want to thank every single member of the class of 2021. You are all amazing individuals, and my favorite thing about the past 4 years has been getting to know you and to serve as your leader. Our shared experiences at ESOP will keep us close long after we have graduated. I am so excited to see all of us enter this next chapter of our lives, and I sincerely wish each of you all the best. Thank you.
Hi everyone! My name is Donna Steinbacher, and it has been an honor to serve you as your Vice President these last couple of years. I am so excited for our whole class, and I can't wait to see where everyone ends up. I just wanted to say how unbelievably proud I am of all of you. And with that, I'll say congratulations and go Heels.
Class of 2021, we made it! My name is Forrest Koenigsberg, your trusty class secretary and treasurer, coming to you live, well, not exactly live, but pre-recorded from Asheville, North Carolina. And I just wanted to take a moment and acknowledge all the hard work that all of you have put in over the past 4 years. It's no small feat to get your PharmD, particularly from the #1 school of pharmacy. It's been truly inspiring to work alongside each and every one of you, and I know that all of you are going to go on to do phenomenal things throughout your careers. So, enjoy this moment, enjoy this commencement, and cheers.
Justin Acker.
Gloria Adedoyan.
Hiba Alzubi.
Bob Amadon.
Lee Jean Arpai.
Brooke Baker.
Meredith Hope Ball.
Jisun Ban.
Cole Barnhart.
Blake Borda.
Zachary Nielsen Beard.
Lauren Bell.
Abigail Benfield.
Austin Clark Bentley.
Ellen Marie Berggren.
Joanna Billings.
Virginia Bland.
Griffin Blandford.
Lauren Buguzali.
Megan Bowney.
Molly Hendricks Boutwell.
Morgan Bowling.
Dominique Brombot.
Ethan Brenneman.
Matthew Anderson Broadwater.
Anna Elizabeth Brown.
Arden Bowie.
V. Bowie.
Lauren Jane Burton.
Jenna Aline Caldwell.
Christian Cavanis.
Emily Chang.
Alice Chang.
Min Jung Chu.
Nicholas Cipriano IV.
Cody Close.
Hannah Connolly.
Jeremy Connor.
Cindelyn Crawford.
Stacy Cottrell.
Ana Carolina da Silva Makarenko.
Spencer Davidson.
Adrian Davis.
Anne DiBernardo.
Grace Evelyn Denton.
Lorna Doucette.
Erica Nicole Drain.
Taylor Easley.
Candace Elder.
Ifedelapo Fashina.
Elizabeth Marie Foster.
Cecily Quinn Fox.
Taylor Nicole Gallion.
Andrew Gebhardt.
Rachel McGuire Gilmore.
Caitlin Marie Granger.
Devin Green.
Shu Gu.
Amy Geisinger.
Yang Guo.
Miranda Neal Hayslip.
Lori Becker Halligato.
Taylor Nicole Harris.
Vincent Harris.
Mitchell Haynes.
David Hicks.
Emily Hua.
Shu Yen Huang.
Thomas Jackie.
Kelly Jameson.
Che Yang Jong.
Sarah Kennedy.
Wade Kennedy.
Hannah Kim.
Jesse Kim.
Ko-En Rebecca Kim.
Stephanie Kim. Forrest Konigsberg.
Akshara Kumar. Lauren Lamb,
Caitlin Victoria Lambert,
Bernadette Lee,
Diana Lee,
Balaji Lennon,
Jesse Lewandowski,
Sydney Lynn McEachern,
Savannah Kinsey McPherson,
Jade Alexia Mills,
Sarah Catherine Mills,
Rashid Muhammad,
Michelle Muir,
Ashley Mull,
Kristen Rachel Nelson,
Jessica Nicole Newman,
Susan No,
Erin Nicole Nifong,
Claire O'Loughlin,
Lou Panachikonko,
Nadej Paquette,
Sabrina Park,
Tyler Paysauer,
Anand Patel,
Malik Patel,
Viraj Patel,
Jacob Pearl,
Matthew Peary,
Jeffrey Penley,
Vera Hervitsky,
Morgan Phillips,
Thomas Christopher Finizzi,
Jefferson Pike Jr.,
Yami Polanco,
Alana Post,
Nithya Pathareddy,
Lois Quay,
Melissa Rink,
Maria Gracia Rodriguez,
Jack Rowe,
Marissa Ross,
Daniel Vidaluga Ruiz.
James Patrick Sara.
Jennifer Ann Schweiger.
Jeffrey Seals.
Pooja Shah.
Julie Shiayo.
Alexis Shook.
Colin Smith.
Carly Spate.
Taylor Sprague.
Madison Stanley.
Sarah Catherine Ann Steedman.
Donna Angel Steinbacher.
Andrew R. Stanger.
Todd Stewart.
Emma Sullivan.
Catherine Sun.
David John Tasca.
Peter Tao.
Megan Tran.
Kelsey Truitt.
Carly Tysinger.
Caitlin Van Hersom.
Daniel Wadsworth.
Chris Wang.
Galena Wang.
Mackenzie Louise Warner.
Taylor Werner.
Thomas Jeffrey Wirt.
Zachary Whitehead.
Anita Yang.
Michelle Yee.
Dihe Grace Yuk.
Danielle Ashton Yeomans.
Sushan Yu.
Yi Zhang.
My name is Jeff New, and I'm president of the Pharmacy Alumni Association. And I want to share with you the Pharmacist Oath. I promise to devote myself to a lifetime of service to others through the profession of pharmacy. In fulfilling this vow, I will consider the welfare of humanity and relief of suffering my primary concerns. I will apply my knowledge, experience, and skills to the best of my ability to assure optimal outcomes for my patients. I will respect and protect all personal and health information entrusted to me. I will accept the lifelong obligation to improve my pharmacy knowledge and competence. I will hold myself and my colleagues to the highest principles of our profession's moral, ethical, and legal conduct. I will embrace and advocate changes that improve patient care. I will utilize my knowledge, skills, experiences, and values to prepare the next generation of pharmacists. I take these vows voluntarily with the full realization of the responsibility with which I am entrusted by the public.
I would like to offer my sincerest congratulations to all of our graduating students on this commemorative day. The completion of a UNC Eshelman School of Pharmacy degree is a substantial accomplishment for which not only our graduates, but also their families, friends, and our professors and staff deserve recognition. Many of those supporters are watching today, and I thank you for the tireless support and encouragement that you have provided today's graduates. To the class of 2021, I give you my warmest congratulations and wishes for success in your future endeavors. Go kick some butt and change the world. It's waiting for you.